and as well as not only mentally, but you must be physically fit, because you have to deal with the various kind of patients, as you have to lift them, you have to change their positions, so you have to deal with the various kind of things. You have to give them a walk on a wheelchair, so you must be physically as well as mentally fit in order to be a caregiver. Now next one is problem solving skill, that there may arise various kind of problems while you are in the work. So at that time you must be able to think on the spot, that you must be able to create a solution to that problem so that you can deal it very easily. Now the next one is respect for privacy. Sometimes there are persons who doesn't want to reveal their each and everything to their family members as well. So at that time you will be ready to respect their privacy. At that time you will be ready to respect their privacy and not to tell anyone about the problems because they don't want it. So you should not be babbling about the problems to their family members or the professionals. So you should keep in mind that. Next one is cultural sensitivity. As we all come from the different kind of cultural background, so here also, if your patient is from a different culture or the different background, then at that time you should respect the cultural diversity of that patient too, because sometimes let's take for example that you are a Hindu but your patient is a Christian. Now there is a Christmas going on, so you should get involved in that festival, so that you will feel them, you are also involving with them, you are also respecting them. So these are the qualities of the caregiver you should be needing. Now next one, the next topic we should be talking about is that who need caregiver, what kind of people need caregiver. The first one is children. So the children's means the infant or the children from 1 to 2 years, they need caregiver if their mother are not available at that time, if their mother is job holding or something like that. So at that time small children and the infant, they need daily, not the daily but monthly checkups. There are lots of vaccinations that they must be needing it. So at that time the children also need the caregiver in case of absence of their mother. The next one is adult. Sometimes adult, healthy adult, not the healthy adult, but the adult who are suffering from the chronic diseases or the adult who are suffering from the acute disease, they also need the caregivers. At that time they can also hire them. The next one is elderly. Among this, I think elderly people mostly need the caregiver because at that time they are not able to do perform their daily activities in a good way, or they cannot do the daily activities because of their old age, because of their pain and a lot of things. So at that time the elderly people mostly need the caregiver. The next one is pregnant women. Pregnant women also need the caregiver because this pregnancy time is considered as a very vital time for them, as very crucial time for them, as they will be needing a lot of care. There are two phases of the pregnant woman, that is, one is prenatal care and next one is postnatal care. Prenatal care means the first phase of the pregnancy, whereas postnatal care is after delivering the baby. So at these two phases, the pregnancy woman will be needing a lot of care. So at that time they need the caregiver. And the next one is the people with the chronic illness. I already mentioned that chronic illness is the illness that can be more from 3 months or also the more than 6 months they are suffering from. So at that time also the people will be needing various kind of treatments, various kind of diagnosis and various kind of medications. So at that time the people need caregiver. Now the next one is individual with the disability. So as the people have some people have disability by the birth, whereas the people have disability after getting the birth or because of some kind of accidents. So if they are unable to move on themselves or are unable to do their daily kind of activities, then at that moment they will need the caregiver as well. And the next one is about the mental health patients. Mental health patients is somebody who has a mental health problem, such as suffering from the depressions, anxiety, then bipolar disorder. So making it a little bit simple, bipolar disorder is a phase where it is about the bipolar disorder means sometimes it is a phase that you mental illness. It is basically a mental illness where there is a two phase. One is manic bipolar, another is depressive bipolar. Manic bipolar is basically the phase where you feel very much happiness or where you exaggerate the very much, whereas the depressive bipolar is that you want to end your life. You don't want to do anything. You are very much depressive and you don't want to mean anything. Then the next one is schizophrenia. The schizophrenia is the mental disease where people have hallucinations, people have delusions, that they are seeing the things that are not originally there. They are just thinking in that way that they are seeing the peoples, they are seeing the various kind of things. We have heard about these stories like these people have seen the ghost or these people have seen that kind of things. They are just hallucinating it. They are not having, they are just having the bad times in order to control their thoughts. These are the people who cannot control their thoughts. So these kind of people also need the caregiver. Now the next one is